This is not a regular exercise by some group to keep fit. It is a walk that is health-related to sensitize the public and the authorities of the plight of people living with sickle cell disorder. In Nigeria, it is estimated that over 150,000 babies are born annually with sickle cell disorder, and 1 out of 4 Nigeria is a carrier, the second highest killer of children in Nigeria below 5 years. Certainly, sickle cell disorder is a global health challenge with psychosocial implications. Medical experts say those with the disorder suffer a higher than average frequency of illness and premature deaths. The condition can also cause heart attacks, kidney failure, severe infection, and sudden death. Despite the large number of people with sickle cell disorder, the Nigerian society in general still has a negative attitude to sufferers.
Blood disorder whereby the red cells do not perform their functions of conveying oxygen to the various parts of the body because of the abnormal sickle shape.
The children that are born into this type of family, they tend to suffer a lot. I've managed a few of them, and the crisis is alarming. They are almost always in pain.
A lot of people don't have access to good quality medical care, makes it really, really worrisome. And when they have crisis, because they don't have the means to take care of themselves, it gets really bad. They escalate and then they die.
How can sickle cell anemia be managed by those who carry them?
There are several products and there are several researches on that, and several people are working on that. Now, some people do stem cell treatments, but all those treatments are costlier than preventing it.
Playing by the rules of the doctors. Eat well, take your drugs, drink water regularly, less stress.
Isaac Sabo and others living with sickle cell anemia narrates their experience.
Even in my study, the sickness couldn't allow me to study my primary school, my secondary school.
What is the response in efforts for cure?
Sickle cell has no cure, but with blood bone marrow transfusion, you can actually cure it, but it's very expensive.
What government needs to do is beef up sensitization on sickle cell, let people know the dangers of sickle cell.
They have to avoid adverse weathers, avoid getting infected by malaria.
Says when the genotype of a parent is SS and the other parent who is SS, they get to have sickle cell patient.
The experts say there is an increasing need to make hydroxyurea standard care in all sickle cell patients, particularly in developing nations where the burden of the disorder can be crippling to the individuals involved, and the need for affordability if the maximum effect on global health is to be achieved. In Abuja, Ifeanyi Ezuma, NT News.